Welcome to the deep dive. You've sent us some really fascinating material this time.
Yeah, it's all focused on brain health.
Exactly. Dementia, ADHD,
Right.
even the potential to, make your brain better.
So our mission today is basically to pull out the key stuff, the actionable insights from these sources you sent.
Right, especially from this YouTube transcript we have. It's a conversation with Dr. Daniel Amen and Rich Roll. Dr. Amen, obviously a huge name in brain health.
A really deep conversation, yeah. Decades of experience there.
And we want to give you, the listener, some clarity. Because, let's face it, brain health info can be overwhelming, right? Especially with dementia concerns rising.
Totally. So the goal is clarity, hope, and some practical things to think about. No jargon overload.
Okay, let's jump in. One of the biggest ideas from Dr. Amen, and maybe the most hopeful, is that your brain isn't stuck.
That's his core message, isn't it? You're not stuck with the brain you have. You can make it better.
And he backs this up. He's looked at, what, over 250,000 brain scans?
Yeah, 250,000 scans. It gives his perspective some serious weight. It's not just theory.
250,000. Wow. And there was that NFL study he mentioned.
Right, with players who, face significant head trauma risks.
And 80% of them showed improvement on his program.
80%. Measurable brain improvement. It really makes you wonder what that program involved.
It speaks volumes about neuroplasticity, doesn't it?
Absolutely. That's the key idea underneath all this. The brain can change. It can rewire itself throughout life.
He talks about the hippocampus, the memory center.
Yeah, and new stem cells being created there all the time. He calls them baby seahorses, which is kind of fun.
Huh. Yeah. And the point is, our behavior, our choices, they actually influence whether those new cells grow or not.
Exactly. So we're constantly shaping our own brains, whether we realize it or not.
Which kind of throws that whole old dog, new tricks idea out the window, at least for the brain.
Totally. We can always learn, always improve. Now, he also brings up something pretty pointed about psychiatry.
Oh, right. His frustration that it's like the only medical field that doesn't routinely look at the organ it treats.
Yeah, think about it. Cardiologists look at the heart. Nephrologists look at kidneys.
But psychiatry has traditionally relied on symptoms, checklists.
Right. Not direct physiological assessment of the brain itself.
Yeah.
And that's what led him to SPECT imaging.
SPECT imaging, single photon emission computed tomography. Can you break that down simply? How does it let them look?
Sure. So basically, it's a scan that shows blood flow and activity patterns in the brain.
Okay.
You get a tiny, safe amount of a radioactive tracer in your bloodstream. It emits particles, photons, and a special camera detects these photons. Then a computer builds a 3D image showing which brain areas are working harder, less hard.
This is like a functional map,
Yeah.
seeing the brain in action.
Exactly, a dynamic picture. But, and this is really important.
The scan isn't the whole story, right?
Absolutely not. Dr. Amen is clear on this. The diagnosis comes from everything, the person's history, neuropsych testing, and the scan findings. It's all put together.
He tells that story about his first SPECT patient.
Oh, yeah, that's a powerful one.
This woman, suspected adult ADD, history of a suicide attempt.
Right. High IQ, but struggled hugely with focus, finishing things. And her scan at rest looked normal.
But
Then they had her concentrate during the scan, and boom, decreased activity in her frontal lobes and cerebellum, the exact areas needed for concentration.
so the parts of her brain needed for focus were actually shutting down when she tried to focus.
Precisely. And seeing that scan, that visual proof, it was life-changing for her.
So.
Well, it showed it wasn't just lack of willpower, there was a biological reason for her struggles. It reduced her shame, she stuck with treatment, her life improved relationships, career.
Wow. Understanding the why made all the difference.
It really highlights how seeing the physiology can shift everything.
But getting this accepted wasn't easy for him, was it? There was pushback.
Oh, definitely. He talks about facing a lot of resistance from the traditional medical community, especially early on.
Why? Just because it wasn't the standard way?
Pretty much. Concerns about it not being standard of care, not fitting the symptom-based diagnostic models.
But things have shifted somewhat.
It seems so. There's more evidence now. He mentioned, 80 studies by 2016 supporting SPECT?
Yeah, and Discover magazine recognition.
Right. And even Canadian guidelines came out in 2021 for using SPECT in psychiatry, which he felt validated their approach.
Plus, the sheer number of scans they've done, over 250,000 referrals globally. That's significant real-world use.
It really is. Actions speak louder sometimes.
Okay, so moving beyond specific diagnoses, what big picture insights does he draw from all these scans about brain health decline.
Well, a big theme is unhealthy lifestyles and what he calls undisciplined minds driving cognitive issues.
And the depression-dementia link.
Yeah, that's a concerning one. He says depression doubles the Alzheimer's risk in women, quadruples it in men. He sees them as interconnected brain health problems.
And that story about his nephew, Andrew, that was intense.
So powerful. It perfectly illustrates how a physical brain issue can look just like a psychiatric one.
He was 9, right?
Yeah.
Happy kid. Then suddenly aggressive, dark drawings.
Yeah. Could easily have just gone down the standard psych route. But Dr. Amen pushed for a scan.
And they found a cyst.
A big one, yeah. Golf ball sized, pressing on his left temporal lobe. Surgery removed it, and Andrew went back to being himself. Completely.
It's chilling. Shows why looking at the brain can be critical.
Absolutely. And he has other examples. Justin Bieber, misdiagnosed bipolar. The woman whose schizophrenia was Lyme disease.
Even his friend with panic attacks after a bike accident turned out to be a brain injury.
Right. It really hammers home the brain-behavior connection. He even brings up Phineas Gage, the classic historical case.
Ah, the railroad worker with the rod through his head.
Yeah.
Changed his whole personality.
Exactly. Early dramatic proof of brain structure affecting who we are.
So given all this, his focus is really on taking control. He talks about brain envy.
Yeah, I like that term. It's about developing a real appreciation, a love for your brain, wanting to protect it.
Like we do for heart health, right? We know lifestyle matters for preventing heart disease.
He's saying we need that exact same proactive mindset for our brains.
Which leads to his bright mind's mnemonic, a way to remember the big risk factors.
It's a great framework. Breaks down the 11 key areas. Should we run through them quickly?
Yeah, let's do it. B is
blood flow, super critical. Low flow is linked to Alzheimer's risk.
Yeah.
Retirement and aging, basically staying active mentally and physically as you get older.
I is inflammation.
Huge one.
Right.
Chronic inflammation damages brain tissue. Big underlying factor in many diseases.
Genetics.
Genetics. Can't change your genes, but knowing your risks helps you be more proactive.
H is head trauma.
Right. Even seemingly minor stuff can add up over time.
T.
Toxins, environmental dietary stuff in personal care products. It all matters.
Okay, that's bright. What about minds? M.
M is mental health. That strong link between emotional well-being and cognitive function. It goes both ways.
By
Immunity and infection. Chronic infections, immune issues can impact the brain.
N.
Neurohormones. Keeping hormones balanced is vital for brain function.
D is diet.
Absolutely. Fuel for the brain. Poor diet, poor function. Simple as that.
And finally S.
Sleep. Non-negotiable for brain repair, memory consolidation, everything.
So comprehensive. Really shows how interconnected everything is.
It really does.
Now, what about someone listening who's maybe thinking, oh no, I haven't lived the healthiest life.
Yeah.
Is it too late for my brain?
That's such a common fear. But his message is strongly hopeful here.
Back to neuroplasticity.
Exactly. He really hammers home that the brain can change, you can improve it pretty much at any age. It's almost never too late to start.
He tells that story about Trygve Gloss, the athlete.
Yeah, Trygve, former pro athlete, lots of issues from alcohol, concussions. His first scan looked pretty bad, apparently.
But then
Then he committed. Healthy lifestyle, no alcohol, good diet, exercise, supplements, and just 2 months later.
significant improvement on the scan.
Remarkable improvement, yeah. It just shows the brain's capacity to heal if you give it the right conditions. That's why he emphasizes looking, getting assessed to see where you are now.
That's really motivating. Okay, let's dig into IWA from bright mind's inflammation. We hear that term a lot. How does it hit the brain specifically?
Well, chronic inflammation is like this low-level fire smoldering in the body, and it definitely damages brain cells over time. It's linked to so many chronic illnesses.
And what can we do? He mentioned omega-3s.
Yes, he says a huge percentage of people, like 98%, are low in omega-3s. These fats are crucial for fighting inflammation and building brain cells, so supplements or fatty fish are
Your
key.
oral health? That was surprising.
Right. Gum disease isn't just about your teeth. It creates inflammation systemically, and there are links to both brain and heart disease. So flossing is brain health.
Yeah, good to know. Any specific blood tests people should consider?
Well, besides checking omega-3 levels, things like blood pressure are crucial for brain blood flow. Iron levels too, not too high, not too low.
CRP for inflammation.
C-reactive protein, yeah, that's a general inflammation marker.
Yeah.
And maybe the ApoE4 gene test if Alzheimer's runs in the family, just for awareness, though it's not a guarantee.
Got it. And what about those toxins, the T factor? everyday products.
Yeah, he really pushes for awareness here, using resources like the Think Dirty app or the EWG database to check what's in your personal care stuff.
Because there isn't much regulation.
Often not enough, he argues. Lots of potentially harmful chemicals in things we use daily. And he also links weight to toxins, as fat stores toxins, but also directly mentions the impact of weight on brain size.
Right. The research showing overweight or obese individuals tend to have smaller brain volume.
Exactly. Dr. Raji's work suggesting the brain can look biologically older, and his own NFL study data showing lower frontal lobe activity in heavier players. It all connects.
Taking care of the body really is taking care of the brain. But it's not just biology, right? He talks about psychological factors too.
Absolutely. It's holistic. Mental health, social connections, even a sense of purpose or spirituality. It all feeds into brain health.
That one-page miracle exercise he mentioned.
Yeah, defining your goals across different life areas and focusing on accurate thinking, not just positive thinking. Realistic optimism.
In therapy for past trauma.
Right. Things like EMDR or ISTDP can help clear barriers that stop people from making healthy choices. And again, seeing your own scan can be a huge motivator, especially with addiction. Different addiction types might need different approaches based on brain patterns.
Fascinating. Okay, let's shift to ADHD. You mentioned getting diagnosed later in life was a surprise. What does Dr. Amen say about ADHD that might resonate?
Well, first off, he tackles the misconception that it's all about hyperactivity.
Right, the bouncing off the walls stereotype.
Exactly. He lists 5 core homework symptoms, which are often the real struggle. Short attention span for routine things, distractibility, disorganization, time and space, procrastination, and impulse control issues.
That makes sense. It's not always obvious on the outside.
Not at all. And he talks about the name changes ADD, ADHD, and his view, based on scans, that there are maybe 7 different types of ADD.
7 types. Wow, like what?
Things like classic hyperactive, inattentive, overfocused, where shifting attention is the problem limbic, temporal lobe, ring of fire, which is like overall high activity, and anxious ADD.
That's much more nuanced.
It is. And he says on a scan, often the brain looks okay at rest, but during concentration, you see that decreased activity in the prefrontal cortex, basal ganglia, cerebellum.
The areas needed for focus and control.
Right. He also notes the strong genetic link and that brain injury can sometimes play a role.
That detailed breakdown could really help people who don't fit the stereotype. Okay, now, raising mentally strong kids, his new book topic. What are the key takeaways there, especially with rising youth mental health issues?
Well, the first step is for parents to be mentally strong themselves and use effective strategies. His work combines neuroscience with Dr. Charles Fay's love and logic principles.
Love and logic. What's the core idea?
A big one is avoiding over-rescuing kids. Let them experience natural consequences, with support, of course. It builds competence.
Tough, but makes sense. What else?
Having a clear vision for your parenting, like a family mission statement, strong attachment, is huge quality time, active listening, asking tell me more.
That special time idea.
Yeah, 20 minutes daily, child-led activity, no commands or questions from the parent, just focused attention, builds connection.
And avoiding being enmeshed. Be more like a coach.
Exactly. Notice and reinforce the good stuff. Like the penguin trainers he mentions, reward what you want to see more of.
I like that penguin analogy.
Right.
What about teenagers? That gets tricky.
Still prioritize attachment, but be firm and kind, not permissive. He suggests saying something like, I only do nice things for people who treat me with respect.
Boundaries. And devices. Social media.
Delay as long as possible, supervise closely, use controls. He's blunt about the addictive nature and potential harms, porn, comparison, bullying, worn-out pleasure centers. Parents need to be the frontal lobes until theirs fully develop around 25.
That's a big responsibility. And if a teen seems depressed,
prioritize sleep, manage the tech use, and educate them on how these companies use brain science against them, the evil ruler idea. Build the relationship first, then explain the why behind healthy choices.
really practical advice. Okay, zooming back out, tiny habits, small things we can all do daily.
Yeah, these are great. Start the day saying today's going to be a great day. Actively look for what's right all day.
The good for my brain or bad for it? Question.
Yes. Pause and ask that before you eat something, do something, consume something.
And the nightly review.
The went well today practice. Reflect hour by hour, find the positives. And for food, ask, do I love it and does it love me back? Mindful eating.
Those seem doable. Finally, what about pessimism? Can you really change that?
Maybe not to full-blown optimism for everyone, but towards realism, yes. He brings in Byron Katie's work questioning negative thoughts. Is it true? How does it make me feel?
Challenging those automatic negative thoughts.
Exactly. Turn the thought around. See if the opposite could also be true. Use the rule of 12 for resilience. Don't over-identify with thoughts.
The name your mind trick.
Yeah, giving your inner critic a silly name to create distance. And treating yourself like you treat a friend.
Kindness, compassion for yourself.
Definitely. And that we win or we learn mindset. Every setback is data.
That's a great place to wrap up. It really reinforces that core idea our brains can change, and we have so much power to influence that change every single day.
It's never too late to start caring for your brain. It's incredibly empowering.
Absolutely. Thank you so much for breaking all this down, and thank you, our listener, for joining us for this deep dive.